are there options for people other than stents and surgery?
Absolutely. The conservative measures that I recommend to people when they have coronary artery disease are, number one, diet. Dean Ornish, the cardiologist, who's written several books,
right,
published a study back in the 80s that showed if people modified their diet to the point where they were eating approximately 10% fat and almost none of it from animal origin,
right,
that they could literally reverse the plaques, the clogging of the arteries. This is essentially a vegan diet. It's a pretty tough diet for a lot of people to stick to,
right,
but I've seen it work. I have had patients who have done this and reversed their coronary artery disease. So diet can play an important role.
Mm-hmm.
The other is exercise. Now, when people have heart disease, sometimes they're afraid to exercise, or sometimes they have pain.
Right.
And this needs to be done under the supervision of a physician.
Mm-hmm.
But if you have a stress test, they can determine what's a safe level of exercise for you.
Mm-hmm.
And sometimes it's best done in the course of a cardiac rehab program, where you're supervised by healthcare professionals so that you're exercising in a safe manner, and if anything does happen, you have people there to help you.
What is your experience with stress management in heart disease?
Well, going back to Dean Ornish, part of his program did include meditation. Most people know someone that had a stressful event and ended up having a heart attack.
Mm-hmm.
Okay, and this is something that if people can reduce their stress, or at least learn to manage their stress better, I think it can play a big role.
So stress management can help, diet can help,
Mm-hmm.
exercise can help. Are there any other options for our viewers?
Well, I offered chelation therapy in my office.
What is chelation? I've read a lot about it and heard a lot about it. Can you share it with us?
Yes, EDTA chelation given intravenously has been done for a long time. We've used it for 50 or 60 years to treat lead poisoning.
Correct. That's where I've read it.
Mm-hmm.
It's FDA approved for removing heavy metals, isn't that
Lead
correct?
and heavy metals. So what happened was they were giving some adults this EDTA chelation for lead poisoning, because in certain industries, like bridge reconstruction, workers can get lead poisoning. So
Mm-hmm.
they were giving them this product, and they found that many of them had improved cardiovascular health. So one thing led to the next, and there's been approximately 40 small studies that have been done
Mm-hmm.
that have shown that this has been beneficial in terms of improving the flow of blood to the heart muscle. And again, we don't exactly know why EDTA chelation has this effect. We know it can remove the calcium from the plaques in the coronary arteries.
Mm-hmm.
We know this because we can do CTs before and after and show the decrease in the calcium. But there's probably other factors as well. EDTA is a very potent antioxidant. And some doctors and scientists proposed that this is the way that it works.
Mm-hmm.
And I was very skeptical about this at first, but I had patients that had had it done, and they got better. And then when I was 44 years old, I started having angina. I had an injury, and I couldn't exercise for a few months.
Mm-hmm.
And when I went out to exercise, I started having chest pain. And my cardiologist did a full workup, and he said, well, the good news is your major coronary arteries are open, but the smaller arteries appear to be clogged,
Mm-hmm.
and there's not much we can do for you. So I went and got chelation therapy. And within a couple of weeks, I was feeling great. After just 10 treatments, my symptoms were completely gone. So I became a believer after that.
That's astonishing. And that's something that can be done, administered to someone in an outpatient setting?
Yes, we do it right in my office. People come in, they get a blood test to check their kidney function, and we do a full workup initially.
Right.
And they simply sit in a nice recliner for about 3 hours and visit with some of the other patients, or listen to music, or work on their computer, and they have this infusion. I've experienced over the years that patients with chronic illnesses, whether it's heart disease, cancer, almost anything, diabetes, those patients that did the best were the ones that were using both conventional medicine and alternative medicine.
Mm-hmm.
And I feel I have an ethical responsibility to my patients to present all of their options.
Exactly. I can see that, and that's got to be very gratifying for you as a practitioner.
It is. It very much is.
We've been speaking with Dr. Pierre Anger here in St. Augustine, Florida. I'm Matt Jeffs, and thank you for tuning in.